Hey guys, welcome back to No More Cavities. Today we are discussing about indications of different type of treatments based on clinical and radiological signs. If a patient come with the complaint of pain, what we will do? We can go for caries removal such as Hall's technique. We can go for indirect pulp capping. We will not perform extraction, is not applicable. We can go for pulpotomy. We can go for vital pulpectomy, but the non-vital pulpectomy is non-applicable. What if the patient is coming with reversible pulpitis? Then we will not go for caries removal. We will not go for indirect pulp capping. The extraction will be inapplicable. We will not go for non-vital pulpectomy. We can go for vital pulpectomy and we can go for pulpotomy. Then, if a patient is coming with irreversible pulpitis, we will not go for caries removal. We will not go for indirect pulp capping. We will go for pulpotomy. We will go for vital pulpotomy. And the non-vital pulpectomy and the extraction will be non-applicable. Now, if the marginal ridge breakdown is less than 1/3, then what we will do? We will go for caries removal. We will go for indirect pulp capping. We will not go for direct pulp capping, but we will go for pulpotomy. We will not go for vital pulpectomy, and the non-vital pulpectomy and the extraction are non-applicable. Then, if the marginal ridge breakdown is between the 1/3 and 2/3, then what we will do? Yes, we will go for caries removal. The indirect pulp capping is not suggested. Then we will not go for direct pulp capping. Yes, we will go for pulpotomy. We will go for vital pulpectomy. Then the non-vital pulpectomy is non-applicable, but we will not go for extraction also. What happens if the marginal ridge breakdown is greater than 2/3? Then we will go for caries removal, obviously. We will not go for indirect pulp capping. We will not go for direct pulp capping. We will go for pulpotomy. We will go for vital pulpotomy. And we will also go for non-vital pulpectomy and marginal ridge breakdown greater than 2/3. Extraction and marginal ridge breakdown greater than 2/3 is questionable. For occlusal caries, we will go for caries removal, indirect pulp capping, pulpotomy, vital and non-vital pulpectomy. But the extraction is questionable and we will not for direct pulpectomy. In proximal caries, we will go for caries removal. The indirect pulp capping will be questionable. Extraction will be preferred if there are symptoms and sepsis. The pulpotomy and pulpectomy in both vital and non-vital cases are preferred. For an unrestorable tooth, we will not prefer any type of restoration or any type of treatment. Extraction will be preferred if there are symptoms and sepsis. If the clinical signs are showing us mobility, sinus and swelling, then we will not prefer any type of treatment, but we will just prefer non-vital pulpectomy and extraction. In cases of root gland greater than 1/3, the caries removal, indirect pulp capping and pulpotomy are preferred, but the non-vital and vital pulpectomy and extraction are non-applicable. But if the root length is less than 1/3, what we will do? We will not go for caries removal. We will not go for indirect pulp capping. We will not go for pulpotomy. As well as we will not go for vital pulpotomy as well as non-vital pulpotomy. But we will go for extraction if there are symptoms or sepsis. Caries extending in dentine, if they are extending into outer half of the dentine, then only two procedures are preferred. The first is caries removal plus indirect pulp capping. While the other are not applicable, then if the caries are extending in the inner half, then what we will do? Then caries removal is preferred, but the indirect pulp capping is questionable. While pulpectomy in both cases of vital and non-vital are preferred. If the caries are extending in pulp and are in proximity of the pulp, then pulpotomy and pulpectomy. In cases of vital and non-vital, both are preferred while the extraction is questionable. If there are sepsis, if there is any type of sepsis present, then only pulpectomy is preferred. Extraction will be preferred in cases of internal root resorption, in cases of sepsis, if there is internal root resorption. If there is prefurcation radiolucency, what we will do, we will just prefer extraction and non-vital pulpectomy. So this was all about the indications of different procedure related to clinical and radiological science. Thanks for watching.